And how long were you having hip pain before that, before you had surgery?
So the pain started in September,
Uh-huh.
and I thought that I probably had bursitis of the hip, which I'd had before, and came to see you at that point and got a cortisone shot, which we hoped would help. And then the pain continued, and then we did a guided injection, and that worked for a while, and then it didn't. And then you did another x-ray, and that's when we figured out that we were bone on bone and it was time. So the surgery was actually in February.
Okay.
So it was about 6 months, but I appreciated the fact that there was no, the myth about surgeons is that they would immediately push you into surgery, and that was not the case. That you spent time sort of seeing if there were other interventions that we could use, which I was appreciative of.
Time was spent.
Walking, anything. I mean, it was just really painful,
Yeah.
particularly towards the end. So every step hurt.
Every step hurt. Did it hurt at night?
Yes.
Yeah.
It hurt even when I was turning over in bed.
Right.
Yeah.
So it was a real negative impact in your life?
Totally. Yeah. I mean, and somebody said to me that they could see the pain in my face, you know, so it was very, very clear. I looked a lot older than I do today because of what was going on. One of the things that I laugh about is that everybody keeps saying, is this elective surgery? You know, and the joke to me is there wasn't a choice. You know, it wasn't like, oh, I don't have anything better to do. I think I'll go and get my hip replaced. It was, the pain level was such that it was like, I can't go on this way anymore.
Right.
Not good.
Yeah.
It was hard. It was hard, you know, and it was sort of like, I just had surgery. I know, but we're getting you up.
Right.
The first day was okay. The second day, I think I got a little woozy and my blood pressure dropped, so they cut the session short. But they were there every day. I felt like I was just learning to walk again. I mean, it felt really strange to be up and doing that, and, you know, some anxiety because of what had just happened. So they were really good about staying right close with me initially. And there was definitely, they had a plan about the progress and what steps and how far and all of that. So, I mean, they were clearly knew what they were doing about the process to get me moving again. So I left from the hospital, and then I went to a rehab center for a while because there wasn't going to be anybody who was going to be home with me full time, and I live in a beautiful Victorian that has 40 stairs to get into the house, and that felt way too daunting to do initially, and I felt I needed more support and care to be able to fully get back to being able to function. So I did that, but once I was home, then I had in-home physical therapy. So they were there with me, and we were out walking and doing stuff, and, you know, we did exercises at home, and then when I got a little stronger, then they had me out walking the streets. So that was very exciting, too, to be able to do that. And also understanding that you could take breaks, because at one point I decided to go and take a walk that was probably longer than I should have, but leaning up against a wall, a couple of benches on the way. It took me an hour to make what normally is like a 10-minute trip, but I did it. And it felt really important to do that.
Yeah. And were you encouraged to sort of push yourself?
Yes.
With common sense?
With common sense, exactly.
Yeah.
By both you and by the physical therapist, you know. See what you can do, go a little beyond, but, you know, don't be dumb about it.
Right.
Don't push yourself beyond what's really smart and comfortable. And so that the day that I took that walk, then I came home and slept the rest of the afternoon. So it's like, whoops, maybe that was too much. Slow, steady for the most part, with some emotional ups and downs during the process. You know, I pretty much wanted to be up and running very quickly. You know, I get impatient,
Right.
frustrated. You know, got depressed sometimes because I felt like I wasn't moving fast enough. But as I say, those were small blips. For the most part, it was, you know,
Right.
steady.
And how much?
About 1,000 times better. It's much, much better. Yeah, it's really, really, it's made a significant difference in my life.